Korea's Omicron wave is on a tangible decline, and this reality is now triggering fresh debate over the course of our future strategy against COVID-19. For more, I have Professor David Kwak from Soon Chun Hyang University. Professor Kwak, welcome back.
Good afternoon.
I also have Professor Kim Moon-kyu from Yonsei University. Professor Kim, it's good to have you here.
Thank you.
Professor Kwak, let's begin with your thoughts on recent reports about the XL variant here in the country, which I understand is just one of some 17 combinations of the Omicron's two sublineages BA.1 and BA.2.
Right, as you mentioned, there are many different subvariants that are currently happening. The newly found XL seems to be one of them, and that was the first one to be found in Korea. When we talk about such subvariants, we're mainly talking about the subvariants that happen from the combination of either Delta and Omicron, or subvariants of the variant Omicron itself. So, namely, XL seems to stem from BA.1 and BA.2 variants of the Omicron, and I think it was originally named BA.2.2. But XD seems to have stemmed from the combination of Delta and Omicron and so on. It sounds a little bit confusing, and I don't remember all 17 subvariants of their names, but XF and XE also happens to be the subvariants of Omicron. And the point that I want to get out of this is that the variants that are happening and seems to possibly happen in the future would most likely be the subvariants of Omicron itself. And I take this very positively, because Omicron itself was known to cause relatively less severity in patients and also possibly in lower numbers of deaths compared to the prior variants. And as we expect to see even further variants of such less severe causing virus variant, I'm hoping that it'll create possibly faster transmissible variants, but hopefully even further less severe and less death-causing variants as well. So if we look at that person, one case that happened in Korea, the XL, the person was only have received 3 inoculations of vaccines and is currently showing no symptoms whatsoever. I think that is also good news, but also the fact that the XL variants that happened in overseas has not caused that much of a big deal either yet. So I'm hoping, and I'm having my fingers crossed, that it'll continue to be that way, but also for the future variants, obviously further studies would have to be needed, but I'm hoping that it'll stay mild and also less casualty as well.
Right. And staying with the situation here in the country, Professor Kim, the number of patients in critical condition remains on the 1,000 level, and the daily losses of lives continue to hover on the triple digits. Having said that, what are your thoughts with regard to our current situation? Is it under control?
I would say that it's barely under control. Current status is a result of 2 weeks prior patient situation. And usually the patient starts with mild symptoms, and some they recover, some become critically ill. And after 2 weeks, we know that this patient was infected about 2 weeks ago, who needs treatment in ICU beds. And the total number of cases is decreasing, and we can carefully expect that 2 weeks later, this critical cases might decrease also. But anyway, still, this huge number is a big burden to intensive care units. And it's not just only for the intensive care unit. I mean, the total medical facilities are outstretched, and all the manpowers are getting overloaded. So, and that can result in a less chance for critical patients to get proper treatments. All the emergency departments are busy. We have to wait for a phone call calling from various hospitals asking for beds, and sometimes we have a delay, and those delay might result in a critical result. So I would say it's barely controlled, and I hope that this number will decline week by week.
Right. And against that backdrop, Professor Kwak, the government, for its part, it's looking to lower its classification of COVID-19 from a Class 1 infectious disease to a Class 2. First then, what are the implications of this downgrade on the treatment front?
Well, I'm not entirely sure what the implications will be, formally speaking, because if we go through the examples of what are differences of the diseases that are classified in either classification level 1 or level 2, obviously, by definition, the diseases that belong to classification level 1 is a disease that can cause threat to the national health system. And it needs to be reported to the government immediately if one's found. But also, classification level 2 does not differ that much, but it differs in the sense that it needs to be reported within 24 hours of finding. But other than that, there are overlappings of monitoring and management of diseases that belong to each of the classes. People will be known pretty soon of the examples of what belong there. So other than the formality and the title, I don't think it differs that much registratively speaking, by downgrading the classification. I guess the only biggest difference that we'll visually see is the fact that rather than having to trace it numbers by one by daily confirmation cases, I guess having it to report within 24 hours would put it in a situation where reports will be made rather weekly than daily. But other than that, people are currently worrying that if it goes down to the level 2, the national insurance system will not cover the fees for the tracings and testings for COVID-19. But that has yet to be decided by the government, and it's quite uncertain whether or not that'll be true. So we'll have to wait and see. But other than for that purpose, really downgrading or even upgrading back from level 2 to level 1, I don't think will make that much of a difference in a clinical sense.
Right. But in the meantime, Professor Kim, I understand that a change in the classification of an infectious disease also allows for its treatment at any local clinic as opposed to a designated medical center. Having said that, is that measure safe when you're considering the traits of COVID-19?
Well, I have the answer yes and no. And I would say that we had a good strategy against COVID-19 since it started from Wuhan until the Delta variant. But the emergence of Omicron make this strategy not efficient. I mean, Omicron variant has a high R number, reproduction number, and that's the reason we had this high number of cases right now. This Omicron is transmitting so fast, and thankfully it's not that devastating, not on high mortality. So that's one of the reasons that pushes the government to change this level 1 to level 2, and if you belong to level 2, you don't need more, negative rooms to prevent transmission. Anyway, if we had this outbreak with Delta variant, it would be very devastating, but thankfully it was because of Omicron, so we didn't have that high-rocketing cases of mortality. So it is somehow safe to go to the clinic, even though there might be a Omicron patient infected with Omicron. But still, you have to be careful with the elderly and having underlying conditions. So now it's the portion of the people, the patients, they have to take care of themselves. The government is opening the clinics to take care of all the patients, and you have to protect yourself. You have to wear masks, hand washing, and try to keep distancing from possible infected people. So that makes the ball go to the people with elderly and underlying conditions.
Right. And a greater sense of autonomy and a sense of responsibility for patients themselves then.
Yes.
Professor Kwak, a further lowering in the classification of COVID-19 will reportedly allow for the lifting of the mandatory isolation period for COVID-19 patients, which is currently the case over in England. What are your thoughts on the wisdom of this particular measure?
Well, that's the particular issue that I was referring to when I mentioned that there is an overlapping of management techniques that actually resides in both the classes, either class 1 or class level 2. The fact that we have currently the influenza virus stationed in the classification level 1, and to my knowledge, I think tuberculosis still belongs to classification level 2. The reason I'm bringing these two examples up is because even though, despite influenza being the classification level 1, it is not mandated that people be quarantined when having influenza. People concurrently taking Tamiflu, managing themselves, are not legally mandated to stay home for certain numbers of days. As opposed to tuberculosis, if you are infected and if you're diagnosed, you are, I wouldn't say legally, but maybe legally, but at least clinically speaking, they are mandated to stay within a hospital facility in a negative pressure room until they're treated for a certain period of time and they're clinically better. And then they're discharged to keep on taking certain medications. So the changing of the classification, the lifting of the mandates for quarantine is yet to be decided for SARS-CoV-2, obviously, but I don't think it'll depend on the classification of this virus, but rather, as Dr. Kim already said so, it'll depend on the mortality rates and the numbers of severe cases that it'll further cause in the future when there are occurrences of more variants. And it's really, I don't think it will be clinically titled by the classification, but more by the nature and the fashion of transmissibility. So we have to really focus rather what's more important. I don't think classification in this matter should be more important than the nature of the virus itself.
Right. Professor Kim, authorities are also reportedly looking into the possibility of lifting outdoor face mask requirements while mandating them indoors, of course. But some health experts believe this lack of consistency, if you will, may lead to possible confusion and conflict. What are your thoughts?
Yes, it's causing confusion, but personally, I agree that the wearing mask outdoors is not that necessary right now. If we know all the information about COVID-19 at the beginning of this pandemic, I think we didn't have to wear masks outdoors. But 2 years ago, we didn't know about this virus, so we had to wear masks indoors and outdoors. Right now, all the instructions given by authorities is based on scientific evidence, and the necessity of wearing masks outdoors is not that strong compared to indoors. So we have to wear masks indoors, but outdoors, even at the beginning of the pandemic, the CDC in the United States was confusing. We had to wear masks or not. They were not so clear at that point. So if we meet another pandemic within a few years, I think we might have to wear masks even outdoors at the beginning of the pandemic, because we don't know how it's going to work out. So yes, now it's time we have the information. Now I agree that we can start wearing masks outdoors, but under some conditions that we are not so crowded. The people, if they gather too crowded, still you might have to wear a mask. And if we keep distance, now I think we can relax on those things. And if somebody is coughing, then you have to be careful. So in the conclusion, I mean, you have to bring a mask anywhere you go. You might have to wear it when you go indoors. And when you come out, and if you are far from 1 meter distance from other people, then I think you don't need to wear a mask anymore. Right. Now it's the era of Omicron, not the Wuhan strain.
Right. And staying with mask mandates, Professor Kwak, when do you suppose will it be possible for us to lift the indoor requirement as well?
That's a very tough question, actually. I don't think any time in the near future we're going to see ourselves actually taking off the mask, especially in the indoors. I think there is also a factor of cultural differences or cultural diversity that different countries would approach the same matter very differently. I believe in the US there are differing states that actually has a very different approach to taking off the mask inside. I believe some of the states in the US are currently not mandating even the students going to schools to wear their mask once inside the classes, but some of the states are actually keeping the mandates on them. At this state, as Dr. Kim also mentioned, once again, there is that level of uncertainty regards to what will happen in the future in the subvariants of the current Omicron variant of the SARS-CoV-2 virus. Meaning, currently we know for a fact that it won't cause too much trouble even if we took off our mask on the outside. On the inside, we have to be a little bit more careful, so it stays on. But hopefully in the future, when it becomes more weak, then we'll be able to take it off. But with that level of uncertainty, there's still that little chance that it might become more severe again. It might become more dangerous again. In that case, we would have to start wearing the mask back up. So that point of time, it's really tough to estimate. I don't know when it will happen or what will happen of it, but if we experience enough time period with the lack of severity from the SARS-CoV-2 and the safety that we would have by keeping the distancing guidelines we currently have, I think we'll gradually be able to take it off, even if not guided by the government itself. So I foresee possibly in the few months, let's say 3 to 4 months afterwards, people will start talking about maybe lifting the mandates on the mask on the indoors. But I hope that for our own safety, this would not be just for SARS-CoV-2, but it also applies to many other diseases, respiratory transmissible diseases. It is still better to keep the mask on at this point.
Right. It really is a difficult question, the million-dollar question right there. I'll give you an easier one right now. Professor Kwak, how do you respond to potential plans or efforts that is currently underway to scale back on COVID-19 testings?
Right. That's also a very good point, a good issue to talk about, actually. We have to think about the purpose and the requirement for the massive scales of testing we currently have. Originally, 2 years back, when we were having Wuhan strains of viruses, we needed massive numbers of testing in order to trace everyone back. But as we see already within even the changes of patterns that are happening throughout the week, a few weeks back, we would have, let's say, higher numbers on Tuesdays and Wednesdays. Now we're seeing even lower numbers on Tuesdays and Wednesdays, but possibly higher numbers on Monday. What does that tell us? I think, personally, clinically, it tells us that the perception people are having towards Omicron has changed so greatly that they're no longer taking it as a huge threat. But they need the formal excuse of having COVID-19 that'll exempt them from certain works or a certain occasion. That's why they need to take the exam or take the test before Monday or sometime early on in the week. And this is my wild guess, so I might be completely wrong on this. But if we follow that logic, the scale of the testing, I don't think is as required as it used to back 2 years ago. So I think it sort of prevails or allows the government to have the excuse to actually lift these mandates of the massive numbers of testing. I think those people, just like we did with influenza virus, those people who are symptomatic, who needs treatment, or who are more vulnerable to the disease but without a symptom, should be tested, and those should possibly remain required. But for other cases where they're obviously going to go through much less severe cases and not so worrisome in regards to the disease, I don't think we'll have to go through all the contact tracing and also these massive numbers of consecutive tests. So I think it might be feasible and quite possible that the government will soon enough take off or lift the mandates for massive numbers of testing.
Right. And moving forward, Professor Kim, COVID-19 vaccination currently is covered by the government here. Do you suppose it should continue to be cost-free for the public to ensure greater participation if inoculations become an annual affair?
Well, I do agree that if it's for free, if the government covers financially, it has a positive impact on general health, public health situation. But you know, fund is limited always, and we have to consider what the positive impact and the negative impact. If, as Professor Kwak mentioned, if there's no more variant causing severe disease, just spreading, the reason for the government to cover all this fund is weakening. I mean, but actually, there's no guarantee that the future corona variant is going to be mild. I mean, there's some chance that we might encounter some kind of a Delta variant with high transmissibility. And then I think that will be the reason, pushing reason that the government might have to cover financially, and it will cover the whole population. And if it's not, I hope that this fund for public health will go to those places necessary. And one more thing I would like to mention is that the vaccine studies in Korea, domestic vaccine studies, didn't have an impressive result till now. And I hope that we can make a success story, a Korean success story of vaccine development in this COVID and also for the future pandemics. So I wish the government has some idea to save some money for those areas.
Right, we'll keep our fingers crossed for that definitely then. Professor Kwak, very briefly speaking, vaccine uptake among children remains quite low. Having said that, what can the government do to address this reality, to boost vaccinations among children here in the country?
It's really giving information very clearly, coming out lucid about what's happened with the vaccines and what it helped, what kinds of people it helped and what kinds of people it did not help as much. Obviously, we're seeing great benefits in those who are vaccinated, especially in the elderly, but there are also happen to be children who did benefit from receiving vaccines, who did not go through severe cases. As we expect to see much higher transmissibility and more cases that are happening in children, because obviously children gather more and they're in school situations and whatnot, they are the ones also who can also benefit from receiving vaccines. And I believe the only way that the government can actually reach the goal of higher rates of vaccination among children is really giving a clear information, whether that be really just a positive sign or negative sign. They have to come out very neutrally about the information.
Right, so raise awareness then basically.
Exactly.
All right, Professor Kwak, as always, thank you very much for your thoughts. And Professor Kim, thank you very much for your insights today.
Thank you.